Well, I think that what we're learning with the genomic technologies is to better classify breast cancers. And I think better classifying is the first step to devising new treatments and to tailoring the treatment to the individual patient. So I think the biggest advance has been in understanding that breast cancer is more heterogeneous than what we thought. There are probably at least 10 different subtypes of breast cancer, and depending on the subtype, we will have to adjust the treatment to each of the subtypes. I think that the sequencing of cancers is the first step to have the full complement of mutations that underlie each of the cancers, and that's therefore the first step to understand their biology. But I think there are other gains that we can get immediately out of knowing these mutations, because each cancer will be defined by its own constellation of mutations, and so for each cancer you'll have a barcode. And so you can use that barcode as if you go to the supermarket. The barcode is used to identify the product that you're buying. These barcodes can be used, for example, for tumor monitoring in circulating tumor DNA. Tumor cells, when they die, they release DNA, the DNA goes into circulation, and we can use this DNA in circulation that is specific and contains the specific barcode of the tumor to monitor, for example, whether women are responding to treatment or not. So I think that, massively parallel sequencing has revolutionized the way we understand the mutations in cancer, but to apply it in the clinic, we have to have a very high standard. And I think that the technology is still developing. The way to analyze the data coming out of the sequencers is also still developing. And so before we can apply this directly in the clinic, we have to have very robust validation of the technology. So to apply this in the diagnostic laboratory, when decisions about patients are going to be taken, will require extreme care. And in Europe, we have a regulatory framework to do that. And I think as long as you follow that regulatory framework, then the tests that will come will be reliable and clinicians will be able to make decisions.